Hello, pod people. I am Mike on the mic, and I am thrilled to be joined by Sue Chapman Moss. Sue has been the Senior Vice President of Payer Strategies at Bayada Home Healthcare over the last 5 years and is now also adding President and Executive Director of Hearts for Home Care. Yeah, Sue. So welcome.
Thanks, Mike. Great to see you. Great to be part of your podcast. Love what you're doing here.
Thank you. We are not, going to beat around the bush. We are going to jump right in.
Sure.
Let's get some heavy lifting exercises out of the way right out of the gate. All right. So you've led Bayada's payer and provider contracting and strategy efforts for years. As you now step into overseeing government affairs and the Hearts for Home Care advocacy program, what synergies do you see between payer strategy and legislative advocacy, especially as they relate to strengthening home care access?
Well, Mike, I'll tell you a little bit about my background and as I see this synergies and why I'm so excited about this opportunity. And it's such an honor to serve in this expanded role. During the pandemic, I was overseeing payer contracting amongst other functions at a large health system in the Northeast, close to where I reside. And we'd been talking about improving care and getting care where it should be. I'll use telehealth as an example. We've been talking about it for over 10 years. We should do telehealth. Patients would love telehealth. Physicians would love telehealth. And then through executive orders, what I'll call the power of the pen,
Yep.
I was signing contracts that were allowing us to get care where people had been wanting it for decades. And I think that's the real synergy here is the way healthcare is reimbursed. So you get what you pay for. And in the home-based care services, roughly half of the revenue comes in through state and federal governments directly. And that's where meeting with legislators and doing this important body of work on advocacy that we're talking about here today is really important. Equally important, though, is that the other half of the revenue comes in through managed care payers, so health plans. And this is where federal and state governments have effectively privatized these services and hired the likes of United or Aetna, Humana, um, Horizon NJ Health, Blue Cross Blue Shield of pick your favorite state. And in both of those situations, the reimbursement and the payment policies allow us to do what I described during the pandemic, allow us to unlock new ways of delivering care where people want to be. And as you know from some of the research that Hearts for Home Care has conducted, 90% of people would like to receive their care at home, and being able to be part of paying for that care at home is such a privilege.
Agreed. And two things you mentioned telehealth. Most, if not all of our interviews so far, talking about telehealth, expansion into other electronic areas to improve access to care and releasing that administrative burden. And I don't usually doubt any Hearts for Home Care research, but I feel like even 90% is low. I think it's 95. I'm just going to say, I don't want to doubt it, but I guess it's ours, so I'll go with it. Let's say home care. So we're gonna stick to this topic for 7 questions. We're sitting at the crossroad of healthcare delivery, reimbursement, and regulation. From your perspective, what is the most pressing regulatory barrier currently limiting agencies' ability to deliver high quality care in the homes?
Hmm. It all comes down to funding, Mike, and it's really hard to believe in a country that spends so much of our economy on healthcare services already that any part of the healthcare economy could be underfunded, but that's exactly what we face in home care. There's a lot of dollars going into various parts of the healthcare delivery system and insufficient dollars going into the funding of home-based care. And I think that's the biggest regulatory barrier that we are facing is really figuring out how to change the conversation without asking our society, our taxpayers to pay more for healthcare. I think it really gets down to getting care where it needs to be and elevating the level of care in the home. The big reason that way that we see lack of funding manifest in home care is suppressed wages. The wages are too low when we're competing with other job opportunities that RNs and LPNs and PTs and personal care aides, they have a lot of opportunities. They're in very, very high demand, and we're not able to pay wages and benefits that are as competitive as we would like to see. And then the second piece is that really results in not enough caregivers, fewer hours of care being delivered, more people having to wait for the care that they need. I think of it as we need to spend more of the healthcare dollar on the actual delivery of care and less on the very large administrative burden that we currently, spend too much of the healthcare dollar on overhead, indirect expenses, other sorts of things that do not result in a single additional minute of care in the home.
Yeah, we definitely need to elevate everyone listening to this. We have a base within Hearts for Home Care. We have legislators that hear, to Sue's point, will go into meetings and we'll tell them that this is the fiscally responsible choice, and they'll go, "I know," and then they'll say, "Well, how come we can't get over the finish line to, if you know this, to get to where we are?" So I think that's leading into the next question. A lot of legislators have heard this that are existing, not new, and they're aware, but what else could we do? So, next question. Hearts for Home Care has built a strong grassroots advocacy presence. As you begin guiding this arm, what key areas of government affairs strategy do you think will elevate the voices of caregivers, clients, and families even more effectively?
Sure. So, Mike, I think we start from I come into this role with the privilege of such a position of strength that you and your colleagues have already established. I was just reviewing 2025 results, and without embarrassing you, Mike, you have helped to grow this movement by 88% year over year. 88% more people are involved in this Great Hearts for Home Care movement. So I definitely would like to pause and celebrate everyone who's already part of the conversation. We thank you. And our ask is to go find your plus one. Go help us double the
Yes.
movement, find others who want to join the conversation. You are the recommenders of the importance of this great body of work. To your point, Mike, I don't think it's more data. I don't think it's more people like me walking into legislative offices wearing business suits. I think what
Yeah.
we really need more of is more stories, more real life experiences. I'll share one of mine. I currently am helping an elderly family member in my personal life deal with the need for care at home, the need to get to doctor's appointments while with some mobility restrictions, and it is hard. It is complicated. Healthcare, despite all that we spend right now, it's some days, even on the best days, it feels like the system's sort of broken. And when I meet with legislators, whether it's in state capitals or in Washington, D.C., it's being able to share those firsthand stories, like my family member who is thrilled when a physical therapist shows up to help her recover her strength after a stroke. I think we need to bring those stories forward. It's a lot of fun, as you know, Mike, to sit down with a legislator, an elected official, and they open a notebook and they get out their pen and they start taking notes on what you have to say. And those stories of clients that need our help and the caregivers and the burden associated with delivering this care, I think that's what we need more of.
Yep. Uh, Appreciate the kudos and love my job. I continue to say that for 15 years. And secondly, the stories. Quick plug during the podcast, you could go to Hearts for Home Care's website and share your story at any time. We have a live stream video opportunity for you to record and send so we could share it with legislators advocating for home care. So, knowing that Hearts for Home Care mobilizes thousands of caregivers and family members each year, what opportunities do you see to deepen their impact, especially in states where home care reimbursement or regulatory frameworks are significantly lagging behind the needs of these field employees and clients?
Hmm. Great question, Mike. Several really tactical ways, very practical things that people can do to get more involved, particularly in those states where the funding gap is even more significant. And so, number one, show up for Advocacy Day. Go meet with your legislators. As a taxpayer, they work for you, and you have an opportunity to go to the State House in South Carolina. It's on February 4, in Florida, February 11, Pennsylvania, March 24, North Carolina, May 13, and Delaware, May 14. There'll be more states coming up. We're still solidifying dates for New Jersey and Massachusetts, Vermont, some of the other states in which we hope to do advocacy days. So show up and be part of the conversation is number one. If you're too shy for that, or too busy for that, then as Mike said, to share your story, submit your story of your own experience as a caregiver, as a family member, or as a client, to Hearts for Home Care's website. We'd love to be able to push some of that, those great stories out through our social media and public affairs team. They're really fantastic at translating that message externally. And then the third way is to tell your own story through your own social media is frankly the easiest way to and the fastest way to get the message out. It's really important that everyone is trying to influence. There's lots of influencers and sitting on the sidelines and hoping for pay increases in those underfunded states that you referenced is not a strategy. Showing up and having a voice, that's the way to make a difference.
Perfect. Let's pivot a little bit to regulatory. Uh, we know there's legislative, but there's also regulatory advocacy work, and as regulatory demands become more complex, providers increasingly spend more time on compliance rather than care. So, what reforms or innovations do you believe state and federal regulators should consider to reduce administrative burdens without compromising quality or accountability?
Mm. Well, I think we're in an interesting moment in that the legislative agenda in Washington, D.C. certainly reflects one of deregulation, limiting the size of big government. And I think that does create some opportunity because it's really aligned with the deregulation priorities that I think we're interested in. I think all of the policies that we have in the industry really need to be looked at through one simple lens. Let's make it easy to do the right thing and hard to do the wrong thing. And there's, as you know, there's been lots of publicity recently, most notably in Minnesota, where there's been Medicaid fraud has been identified. So I think everyone is looking, we're all very committed to getting, there's a lot of good actors in the delivery of home-based care services. Let's keep the bad actors out, but not make it hard to deliver care as a well-run home care agency here in the industry. So I think some really, really specific examples. streamline redundancy, reporting. I can't tell you how many, different agencies request all the same information, but just in a slightly different format, or at a slightly different time of the year, or through a different portal. I think another easy example, AI is obviously becoming more mainstream and part of our everyday lives. I'd love to see that it becomes mainstream in documentation of the care that we're delivering in the home so that our caregivers can be hands on, taking care of our clients' needs rather than hunched over a laptop, dictating or typing in their electronic medical record to check all the boxes. Let's make that easy. Let's take advantage of the technology, and this moment in time that I think, are really uniquely positioned.
Yeah, the one word that hasn't changed is bureaucracy. I think that is a heavy, heavy on top of our shoulder burden in a lot of places, not just home care, healthcare, et cetera. And if we could definitely quicken the process and lighten the load, so we can have face-to-face care, that would be great.
Yes, yes,
Uh, yeah, it is. It's troubling because you do want to provide more care in the home. Uh,
absolutely. I know. I mean, how many times have we all been to a doctor's office lately where, they welcome you in and then sit down and turn around in a chair with their back to you while they're interviewing you and asking you how you're doing and then typing it into the computer. That, healthcare is, it's very personal. And
yeah,
I think technology can enable, more facing towards our clients rather than having our backs to them.
absolutely. So the workforce, uh, advocacy around home care, again, reimbursement is a key focus. But when we say reimbursement, it's because of the trickle down effect of a higher reimbursement helps a lot of other ills. The workforce pipeline continues to intensify downward. In your view, where should government affairs efforts be prioritized to build and sustain a strong home care workforce, both clinically and non clinically?
Mm. Well, healthcare really is a calling, particularly for nurses and direct caregivers. I think that's been lost in translation. I don't think it's viewed as a profession that's particularly attractive by some of the younger generations. I think we really need to change that by making it an appealing role for life, a career ladder, a pay structure, training, mentorship, retention. I think those are all critical factors that we need to be thinking about to attract more caregivers into this important work. And that really does require, being known for the ability to care for people at home safely in a high quality way rather than being known for, the administrative burden or some of the other things that we just described. So I think it's all about, to some degree, some of it is marketing, but a lot of it is, it's real. I think, I have two college age sons, and I don't know that their generation views home care as a career path. Certainly not enough of them view it in that way yet. So I think that's the big opportunity that we are staring at.
Agreed. 20 somethings agreed. Check on that comment.
Yes, does that resonate with you, Mike? You've got some
It
some
does. It does.
some people in the same age bracket, and they're
Yeah.
probably not sitting around with their friends chatting about this as a career path.
No, not at all.
Hmm.
Uh, all right. Crystal ball, magic 8 ball, whatever you want to say. Looking ahead, where do you see the greatest opportunity for regulatory and legislative advocacy to come together, creating a unified strategy to improve reimbursement, expanded access, enhance caregiver support, and ensure that home care remains a viable option for millions of Americans?
Hmm. Well, Mike, I think healthcare is so critically important to every American, to everyone who's part of the movement or everyone who's about to become part of the Hearts for Home Care movement. We need healthcare ourselves. We need it for our loved ones. As I mentioned, certainly I'm in that situation right now. So I think at the end of the day, people are going to get sick. We want everyone to be healthy for as long as possible. But at some point in life, we're all going to need healthcare services. So the unifying strategy, I think, is a combination. It's really the confluence of rate, regulation, and workforce. I think those three pieces need to come together for us to change the conversation. Mike, I'd love in a year from now or 2 years from now for you and I to be talking about something different. It feels like we've been talking about some of these issues for a while. And I think the unifying strategy is aligning. We're really fortunate in that the trade associations across the industry have consolidated. We have the Alliance, we have HCAOA, and many other amazing trade associations and vendor partners who are really committed to the rate and the regulatory remediation and the workforce. So I think we're standing on, right on the precipice of a really big opportunity. Excited to see that crystal ball, I think is also, so those are sort of the tailwinds, right? That's what's going to drive us forward. Alignment, clear messaging, and client stories. I think the headwinds that we're facing are the economy, the overall spend in healthcare in the United States. The one big beautiful bill, HR1, certainly is impacting funding availability for states through the Medicaid program. And we are always facing Medicare cuts at some degree at a federal level, particularly for our home health services. So we want to get more care, and at the same time, we're seeing cuts or threats of cuts in reimbursement rates. That's a little dizzying, and I think those are some of the big issues that we're going to be facing and working on together.
That's great. I would love that crystal ball to say that, and I could pivot and advocate, a little differently and not have to, I don't wanna say beg, but really beg to enhance home care so that people have access to care. That would be great if, we could focus on other things and it was all kumbaya. Uh, I appreciate you joining. Great insight, on not just legislative, but regulatory advocacy for our, listeners. And, speaking of, listeners, what are you gonna hear from next? Well, Home Care You Say is going to be in Miami, February 17th and 18th at the Home Care Show. We are gonna be there live doing interviews with leading home-based care executives. And Sue, is this something that you'd be interested in attending?
Oh, funny you should ask, Mike. I will be there with you. I will be on stage, having a great opportunity to have a similar conversation about payers in the home care space and also government affairs. So I definitely think people should join us. Being from the Northeast, it's a great time of year to maybe find a conference in a warmer location. So we'd love to see people there and love to see people show up and on heartsforhomecare.com, join the movement and be part of changing this conversation.
Thanks for joining us, Sue. We look forward, pod people, to talking to you in a few weeks from the Home Care Show. Everyone have a great rest of your day.